Operation Iron 2.
Okay, let's today, well, actually, I was submitted a question from a viewer of my videos who wanted to know what could be done about a common problem among bodybuilders known as stretch marks. Okay, what are stretch marks? Stretch marks are known medically as striae distensae. You don't have to remember these terms. I'm just throwing it at you. The original, it starts out as kind of like red markings along the skin, and it's caused by the redness is actually caused by ruptured skin capillaries. In this stage, it's known as striae rubeae, with the rubeae referring to a rube or reddish color. Eventually, the color of the stretch marks turns kind of a purplish color, and then with time it turns kind of white, and when that happens, it's known as striae albae again meaning white. Now, the important point here is that stretch marks are best or most treatable when they're in that reddish early inflammatory stage. Once they turn white, it's very difficult to treat. And the truth of the matter is, I'll cut to the chase and tell you that there really is no true effective medical treatment for stretch marks that have turned white, because what stretch marks really are, in essence, is scar tissue. If you look at it microscopically, it looks just like scar tissue. And, scar tissue is just, again, very hard to get rid of. So basically, they were first discussed in the medical literature way back in 1936. As you might expect, women are much more prone to getting stretch marks than men. The type of stretch marks that women get when they get the big belly during pregnancy is called striae gravidarum. And of course, it's caused by excessive stretching of the skin because of the fetus pushing out. The big belly causes a stretching of the skin where the skin can't accommodate. So this bothers a lot of women. It's not really medically dangerous, but psychologically, a lot of men and women consider stretch marks cosmetically unacceptable. Stretch marks also, like I say, they occur very commonly. I think up to as much as 90% of women get some kind of stretch marks while they're pregnant. It also occurs in women who have breast implants. Again, the stretching of the skin by the implants causes a breakdown in the connective tissue fibers, which leads to stretch marks. It also occurs, stretch marks commonly occur during the normal puberty growth spurt. When children start to grow, when the hormones kick in, the skin very often doesn't accommodate quite fast enough to the growth, and they get stretch marks. It also, of course, occurs in obesity, again, for the same reason, an excessive mechanical stretching of the skin, which basically disrupts the connective tissue proteins in the skin, leading to stretch marks. But any type of rapid growth can also cause stretch marks, and here's where we get to bodybuilders. Bodybuilders get stretch marks. You can get it from just normal muscular growth. If you are lucky enough to make very fast gains, you can get stretch marks around your pectorals. And a very common place to get stretch marks in bodybuilders is right here, right in the front delt upper arm area. In fact, a large percentage of anabolic steroid users get those particular stretch marks. In fact, some medical studies, there's my dog Chip saying hello to you guys. In fact, some medical studies tells physicians to look for certain signs of steroid use in their patients. These include stretch marks and acne scars along the upper back, male pattern baldness, that type of thing. So stretch marks are so common in steroid-using bodybuilders that a lot of doctors consider them a sign of steroid use, which isn't necessarily true, because you can get stretch marks never touching a steroid. All you got to do is stretch the skin. For example, I imagine, I don't have any proof of this, if you do a lot of exercises, for example, chest flies where you stretch all the way back, anything where you stretch and you're lucky enough to induce muscle growth, you can produce stretch marks. A lot of this, I should point out, has to do with your genetics. Some people are more prone to stretch marks than others. It has to do with genetics. It has to do with the way they kind of deposit proteins in their skin, collagen, elastin. This is something that's obviously beyond the control of anybody, but it does predict why some people will get stretch marks while others can take a ton of steroids, do these, let's say, stretching exercise and never get stretch marks. Again, it's due to genetic differences. The most common sites of stretch marks include the buttocks, lower back, thigh, calves, breast or chest, and the abdomen, especially in women, as I said, who are pregnant. As I said, let's take a closer look of why would steroids kind of like stimulate stretch marks, and I'll tell you why. It turns out that the skin is loaded with both androgen and estrogen receptors. Now, here's the deal. Testosterone or anabolic steroids, which are, of course, synthetic analogs of testosterone, they kind of inhibit the activity of cells called fibroblasts. Fibroblasts stimulate the proteins that support connective tissue in the skin, such as collagen and elastin. So basically, testosterone tends to kind of like inhibit the connective tissue formation in the skin that keeps the skin strong and prevents stretch marks. Estrogen, on the other hand, has a healing effect. Estrogen, if anything, in the skin will prevent stretch marks, except, again, in the abdomen when women get pregnant, that's a different story. That's excessive mechanical stress on the skin. No amount of estrogen is going to prevent that. So anyway, as I said, mechanical stretching of the skin is considered a basic reason why people get stretch marks, because it, again, causes a rupture of the connective tissue in the skin, and this leads to stretch marks. Some diseases are associated with, there's a couple of diseases, Marfan syndrome, there's a certain heart conditions, associated leukemia. This is way beyond the scope of this video. I'm not going to get into that. And it really doesn't, it's something that really has nothing to do with bodybuilding, so I'm not going to talk about that. One interesting 2015 study, however, found a relationship between increased stretch mark incidence and low plasma levels of vitamin D, or the activated form of vitamin D. And now, in a recent video, I discussed vitamin D. I mentioned that there's an active form called 25-dehydrocholecalciferol. That's what they measure. That's the active vitamin D. In this study, women who showed low levels of vitamin D showed increased stretch mark incidence. Now, these particular women had breast implants. As I mentioned earlier, breast implants tend to stretch the skin, and when you stretch the skin, depending on your genetics, you can stimulate, you can break down that connective tissue, which will lead to stretch marks. So it's an interesting thing. Vitamin D probably has an effect in helping. And remember, vitamin D interacts with those sex hormone receptors. They don't know the full extent of this. This was only one study. But, if you want to, or if you're concerned about stretch marks, it's a good idea to make sure that you have optimal blood levels of activated vitamin D, which would be a minimal 30, and the optimal level is 50 to 60. I'm not going to go into the nanometers and all that stuff. But anyway, what about treatments? A lot of people want to know about treatments. The one particular treatment that might be helpful, again, only in the early stages. In other words, only when the stretch marks are still reddish or purple, where you can see the color. Once they've turned white, none of this stuff's going to help. But in the early stages of stretch marks, if you use a prescription called tretinoin, it's called tretinoin. It's a form of it's a kind of a vitamin A derivative. And again, if you apply it while the stretch marks are still red, in about 20% of cases, the application of this stuff will cause the stretch marks to fade and possibly even disappear. There's another topical treatment called trophyllis. That consists of basically of a type of herbal substance that stimulates the activity of fibroblasts. And again, fibroblasts are these cells that stimulate the deposition of structural proteins and connective tissue in the skin, collagen and elastin. So, hopefully, if you take this stuff, you rub it on your skin when in the early stages of stretch marks, it may cause the stretch marks to fade. Uh, it also, this particular ointment or whatever it is, lotion, it seems to also block the effects of corticosteroids. And I should mention, high amounts of corticosteroids, the cortisone, also tend to break down the structural proteins in the skin. So, you want to try and do anything you can to prevent excess cortisol production, such as, make sure you get enough sleep, enough protein. Don't put yourself under excessive stress because cortisol itself will break down the structural proteins of the skin. There's another ointment or topical preparation called Verum, Verum. This stuff contains hyaluronic acid. Hyaluronic acid is also known as joint fluid, and it's also found in regular skin, and it has a hydration effect. In other words, it kind of puffs up the skin, and it also provides elasticity to the skin. When given to pregnant women, this stuff, Verum, seemed to reduce the appearance and number of stretch marks. And again, it's called Verum, Verum. Still another topical preparation is called Alfastria. Alfastria also contains hyaluronic acid along with vitamins A and E. And again, as I said, the hyaluronic acid stimulates fibroblast activity in the skin and promotes collagen production. This product appeared to work well in treating stretch marks in pregnant women. Pregnant women are the women that most complain about stretch marks. That's why I keep mentioning them. Okay, then there was an even newer preparation. Only one study, it was just done recently. This new preparation, I don't even know the commercial name. I don't even know if it's on the market yet, but it actually contains punica granatum seed oil and croton leria raisin extract. And it showed pretty good effects in treating, again, the early stages of stretch marks. Other treatments for stretch marks include various types of lasers and pulse light therapies. They appear to work by promoting the activity of the structural connective tissues, proteins in the skin that provide strength to the skin and help to prevent and heal stretch mark. These devices must be administered by a dermatologist with best results. I don't know how you could get your hands on these lasers anyway. You can't buy them in Costco, but obviously they need to be administered by somebody that knows what they're doing. They're not for use at home. Other possible treatments for stretch marks include chemical peels, radiofrequency treatment, and microdermabrasion. Uh, Again, only administered by a professional. Of all these treatments, the current literature suggests the most effective is something called non-ablative lasers, specifically the 1,540 nanometer non-ablative laser. Again, this is best used when the stretch marks, are still red. Once they turn white, you're just going to have to live with it. At least they're not as prominent. Now, the best way to sum all this up is to consider the conclusion of a recent medical study that actually examined all the current treatments of stretch marks. And this is what this study concluded. Currently, none of the devices or treatment modalities in the market are sufficient to fully treat striae, which is stretch marks. Even with the best device available on the market, the 1,540 nanometer NFA laser, and with the ideal time frame, results are often modest. A cure for striae is needed. So that about best sums it up. Some of these things might help a bit when the marks are still red, but nothing really works perfectly as far as stretch marks goes. Just do everything you can to avoid them, and with the factors I mentioned earlier. If you want further information about nutrition, exercise science, hormonal therapy, fat loss techniques that work, anti-aging techniques, ergogenic aids, and various other subjects, including preventive health, how to prevent heart disease, cancer, other major diseases, all written in simple English, 40 to 50 pages every month. Apply today to my Applied Metabolics newsletter. That's www.appliedmetabolics.com. The best information, the most in-depth and understandable information you will find anywhere. Beats anything that's on the internet, anything that's on websites, anything in magazines, anything anywhere. I put a lot of work into this, and I'm also including my 54 years of practical and empirical experience, stuff that you'll never find in science studies or on any other blogs, because I experienced it myself, and I'm going to steer you in the right direction in your training and diet. Take care, and if you want to have the best friend you'll ever have, you heard him say hello earlier, that's my dog Chip. Go to your nearest shelter, adopt a dog. These dogs are just so loving and so loyal that they truly are. Believe me, from experience, these are the best friends any human can ever have. And I've come to the point where I can't imagine not having a dog. Seriously. Your friends might stick a knife in your back, your girlfriends or wives might leave you, but your dogs will stay with you to the end. And I mean that. Take care, guys.